Hello and have a good day to Madam Hairina. My name is Nofarhana binti Sharom. So today I'm gonna present about Perthes disease. So the definition of the Perthes disease is an idiopathic avascular necrosis or idiopathic osteonecrosis of the capital femoral epiphysis of the femoral head. So normally it's known as a leg calf Perthes disease, and the Perthes disease is affect about 10.8 out of 100,000 children, and it's more affected for the boys from the girls. So there's a 4 stage of the Perthes disease. So the first stage is the necrosis, second stage is the fragmentation, third stage is the reossification, and then the fourth stage is the remodeling. So we move to the etiology of the Perthes disease. So it's an unknown cause, and then it could be idiopathic or caused by another origin that cause the blood flow to the femoral epiphysis to be disrupted. For example, coagulopathy or trauma. Okay, and then the actual causes of the osteonecrosis is remain unknown, though some research demonstrate that Perthes disease may run into families, but a precise pattern of inheritance has been yet established. So as we can see here from the images, we can see the blood supply. One moment. As we can see here, this one is the blood supply to the femoral head. So for the Perthes disease, the blood we don't know what is the cause of the blood supply to be not reach the femoral head. So that's why there will be a necrosis on the femoral head like this. So this is the different of the normal femoral head, and then what happened when the blood supply is not coming to the femoral head, then this one will happen. So it will become necrosis on the head. So osteonecrosis is caused by an insufficient or defective blood supply to the femoral head fragmentation, and then will cause a bone loss, and then eventual structure will be collapsed. So this is the detail of each stage. So the first stage for the necrosis, is an infection of the femoral capital epiphysis, particularly to the subchondral cortical bone, and then in this stage also the bone will be infected, and then it becomes softened, and later it will die. So we can see normally from the condition of the femoral head, it will be smaller, and it will be widening of the middle joint space. Okay, and then the next one is the stage of fragmentation. So it's about 6 months to a year, the body will try to heal itself. So most of the femoral head will be fragment, and then the collapse will happen. So normally it will show a crescent sign, and then the extrusion of the femoral head extend beyond the acetabular margin. So next, the reossification stage. On this stage, the femoral epiphysis will re-establish as the osteoblastic activity will start grow, and then a high chance that the femoral head may deform permanently above when the 20% of the femoral epiphysis will extruded. So next, the last stage is the remodeling. So during the remodeling stage, a new bone will begins to grow, and then it might be normal, and it might be prone to the deformation, and then it's also possible to expand and the flatten of the new femoral head. So normally in early adulthood, this kind of patient will develop degenerative arthritis. So next, the risk factor. So the risk factor of this Perthes disease, Asian and Caucasian people are the most one will be affected to this disease. And the next one, maybe a person that got thrombophilia, that is a thrombosis in the arteries. which is the blood clot inside the vein and the artery. And then next, hypofibrinolysis in Perthes, that is a clot breakdown that resulting to the thrombosis. And then boys who had a birth weight, their birth weight less than 2.5 kg. So we move to the complication. So the complication of the Perthes disease is an acetabular dysplasia, and the resulting hip incongruency also can be caused by a poorly formed femoral head. So a damage to the femoral head may cause early physeal arrest that resulting in length disparity, and then the natural spherical shape of the femoral head may be lost and the femur may be collapsed. So the lateral extrusion and subluxation is condition that is linked to a poor result and may cause a long-term issue to the patient. So the patient also might feel pain on the rotation referred to the anteromedial thigh or knee, and then it will decrease the internal rotation, so the leg cannot turn, or maybe the patient cannot abduct the hip. And then the atrophy of the thigh and the buttock from the pain will leading to disuse, and then a limb length disparity. So next, the imaging modalities that we use to detect the Perthes disease, there is two modalities, which is the plain radiograph and the MRI. So normally plain radiograph is the main common lah, because as we know, the Perthes disease is the most patient that get the Perthes disease is a child, which is the pediatric. So as we know, pediatric also the patient that commonly not cooperative, so the x-ray would be the fastest and easiest way to check to detect the Perthes disease. So normally the consultant will request AP pelvis and a frog leg to detect the Perthes disease. So but an MRI is an additional modalities because it's more detailed, and then we will use unenhanced and enhanced scala, which is we use gadolinium as a contrast to give to the patient. And then it's also allowed to detect ischemia and the pattern of revascularization in Perthes disease. Okay, so this one is the example of the image of X-ray. So we can see here is the the changes of the femoral head. Okay, and then we can see the both sides of the femoral head will be become fragment, and then is widening on the head, the neck of the femur. And then widening of the medial joint space is seen due to reduced ossification of the proximal femur. Okay, next for the MRI image. Okay, the sclerotic rim is represented by a double line. Okay, this one, as you can see here, on the left side of the femoral neck is different. It's like a bit abnormal compared to the right side. And then there is a small the small amount of joint effusion, and then a line between the necrotic and viable bone margin with a hypertense border of granulation tissue. So next, we move to the technical consideration. So as I said just now, most of the patient with Perthes disease is a pediatric patient, and then so as a radiographer, we know the basic for the pediatric is to adjust the KV and the MAS, because pediatric is more thinness than the normal adult. So we normally, for the pediatric patient, we use highest KVP within the optimum range for the position and the area, and then we combine with the MAS, the smallest amount of MAS, to achieve an adequate exposure to the image receptor. And then normally AEC is not recommended for children under a 36 month. So next, we use a immobilization device. This one is to reduce the motion artifact to avoid repeating exposure. Okay, and then for the example of the immobilization device, we can use as a strap or maybe a strap to make sure the patient is not moving. Maybe the patient mostly the patient came with crying or act as uncooperative patient, so we can use a strap to make sure the patient is stay still, and then we can reduce the motion to get the best image. So this one is the example of the immobilization device that we use in MRI. Okay, so maybe this one also patient mostly of pediatric patient is quite hard to do MRI because we also as adult also maybe sometimes we still afraid of the thing inside, afraid about the sound of MRI. So normally this kind of patient maybe require sedation. Okay, so to that one to help us to give a good image. Okay, so the conclusion, So the conclusion, the causes of the Perthes disease is still unknown. Even a lot of research that try to find the causes of the Perthes disease, why the blood flow to the femoral epiphysis can be disrupted, can be stopped. So we still this one. And then like I said just now, boys are more affected than girls. And then conventional radiography as primary modalities to evaluate the children with Perthes disease. And then MRI is an excellent modality for osteonecrotic development in Perthes disease. So it's a physician's decision on which modalities to apply. But as a radiographer also, we need to understand how to obtain the best image to indicate the pathology. So that's all from me. Thank you for your consideration and for your listening. And thank you.